have to look at primary health care as a gatekeeper. Failure of primary health care is what results in people having to go for tertiary care. Making sure that our hypertensive patients are not coming down with situations where they now need, put in a stent and things like that. Have to I think that is the place where we can win, making sure that our hypertensive patients are not coming down with situations where they now
very large part of most of the established
and things like that.
Western healthcare system.
So obviously we're doing something right. We are bringing up healthcare staff that people want to recruit from Nigeria. So we're definitely doing something right. So for all the people who are running to the UK for treatment, your nurse is probably going to be called Biola.
Hey dear, how you feeling? Okay, can I just take your temperature? There we go. Boop. Boop. Oh, that's alright, should be okay.
At EHA clinics, we make sure that we purchase top-notch equipment that can offer a wide range of services. So we have calibrating plans, we have maintenance plans that we use to ensure that at every point in time, patients are confident that the records that they have with us are accurate.
In terms of quality at EHA clinics and the level of quality that any patient expects to get, it's one of our core values. So, and one of the things that we monitor closely to ensure that when patients come in here, they're safe and that their care is reproducible.
We looked at the entire system of what it was going to take to deliver quality care, and we kind of built that from the ground up. So when we started EHA clinics, we even looked at the facility itself. How do we actually get a proper facility that has things like air filtration built in the air so that as sick people come into the clinic, they're not spreading their illness to people sitting next to them. Quality is not an endpoint, it's a journey, and it's a constant journey. So you can't ever say, okay, well, we've reached quality, now we're okay. It has to be this continuous improvement. So we invested a lot of time and money in making sure our staff became certified by the WHO.
We want to ensure that we are implementing quality systems throughout our organization, right from our primary healthcare clinics through our pharmaceutical distribution and every element of the business that we expand into. We are looking at development and opening new clinics in Abuja, in Lagos, and also in the East.
So what does the future hold for EHA clinics? The future of EHA clinics is really to access affordable, quality healthcare. If our dream came true, we would be in it. We'd have at least 50 clinics, in the next 5 years around Nigeria.
Hi, Gloria.
Hi, Obina.
Just go ahead. Put on your video.
Alright. Okay, good afternoon, everyone. Thank you for joining us. Okay, we're all welcome to today's exciting and insightful webinar. This topic is so timely. We'll be talking about the future of nursing in an AI-driven world, enhancing care through technology. My name is Nurse Gloria Dabo, and I am with EHA Clinics, and I'll be your host for this important discussion as we delve into how artificial intelligence is transforming the nursing profession and healthcare as a whole. As we all know, the world of healthcare is rapidly evolving, and technology is playing an increasingly vital role in shaping the way care is delivered, from AI-powered diagnostic tools to virtual health assistants and predictive analytics. So the integration of AI into nursing is unlocking new possibilities for patient care improving clinical outcomes, and even enhancing the efficiency of healthcare systems. So today we have an expert who will share his insights on how nurses can embrace these technological advancements, how AI can complement the invaluable work of nursing professionals, and the ethical considerations that come with these innovations. So, whether you are a practicing nurse, a healthcare leader, or someone passionate about the future of care, you are in the right place. So, we hope that by the end of today's session, you will have a deeper understanding of how AI will enhance our practice and empower us to deliver even better care for our patients. So before we dive in, permit me to introduce our speaker for this webinar in the person of Nurse Isha Kuturu. Let me just read a little bio about him. Nurse Isha Kuturu is a highly accomplished maternal and child health specialist, is a nurse educator, and migration health evaluator with over 16 years of progressive experience in global health, reproductive health, and healthcare program development. Renowned for his clinical expertise and dedication to improving healthcare outcomes, Mr. Toro has consistently contributed to the advancement of public health initiatives and nursing practices in Nigeria and beyond. His career began with a strong foundation in nursing education, earning a bachelor's degree in nursing science from Ahmadu Bello University Zaria, and culminating into a master's degree in maternal and child health nursing from the University of Ibadan. He also holds multiple professional certifications, including registered nurse educator and registered pediatric nurse credentials. These qualifications have equipped him with the advanced knowledge and skills required to lead impactful healthcare programs, facilitate evidence-based training, and implement innovative solutions in various healthcare settings. As a principal lecturer and head of reproductive health at the Kaduna State College of Nursing and Midwifery, Mr. Toro was instrumental in designing and delivering comprehensive nursing curricula. His leadership in these roles involved collaborating with national and international health organizations to improve healthcare standards, train over 200 nurses annually, and shape policies that enhance reproductive health services across Nigeria. His work with the Center for Integrated Health Programs, CHI HP, and other organizations resulted in sustainable quality improvement initiatives that continue to benefit healthcare professionals and patients alike. He was the MCPDP lead facilitator, Nursing and Midwifery Council of Nigeria, Northwest Zone. He collaborated with the UNFPA, Nursing and Midwifery Council of Nigeria, and the Kaduna State Ministry of Health, and other support partners for the MCPDP program planning, and was able to obtain partnership from UNFPA that sustained the program for 3 years. Mr. Toro is known for his dedication to capacity building, having trained hundreds of healthcare providers, including nurses, community health workers, and medical practitioners. His expertise in qualitative and quantitative research methods has contributed to the development of data-driven healthcare programs that effectively address maternal and child health challenges. Over the course of his career, Mr. Toro has earned numerous awards, including the Nightingale Nurse of the Year in 2022, recognizing his exceptional contributions to nursing and public health, and Award of Selfless Service to Nursing and Humanity in 2022. His experience in clinical instruction, research, certifications in data protection, information security, quality improvement, and health program management places him at the forefront of discussions on the future of nursing, particularly in how technology and artificial intelligence can revolutionize care delivery. As a thought leader in healthcare innovation, Mr. Toro's insight and expertise continue to inspire the next generation of healthcare professionals and drive meaningful improvements in global health outcomes. Without further ado, I will want to introduce our speaker to the floor to continue with the presentation. Thank you so much, Mr. Toro, for honoring our invitation. You have the floor, sir.
Thank you, Gloria, for that lengthy introduction. Thank you for the time. Thank you, the team, the entire EHA team. Please, can you hear me clearly? Because,
Yes, we can.
okay, thank you very much. I will not waste much time. I think it's good we go into the main business of the day. And the topic for today is the future of nursing and AI-driven world, enhancing care through technology. Enhancing care through technology. By just way of introduction, we know that technology has really been it. Everybody is into one stage of technological advancement or another. So AI has come to stay, and it has actually been adopted in health technologies. And this was actually accelerated during the COVID-19, where we were asked to
Hi, Mr. Toro, we're losing you. Hello?
Hello, can you hear me?
Yes. We lost you for a bit. Gloria, right?
We lost you for a while.
Oh, wow.
Yes.
How about now? Okay. So the trend
Yes, we
now
can
is
hear you.
integration of. Okay, thank you very much. So AI has actually been integrated into healthcare for years. And please, I want to stress at this point that I'm trying to take my inferences from Nigerian public health sector and then the health system in Nigeria completely. And then my experiences with the health facilities in Nigeria as well will be my gauge as I discuss on this very topic. So nothing being an indispensable sector within the medical sciences has also reaped into these advantages. AI has actually come in to really build our confidence to actually add up to what we are doing before now. So at the course of this very presentation, we'll see trends, we'll see challenges, and then we'll see what AI has come to add up to our own present health services, please. Some are asking for the link. Please, maybe you can share the link. Maybe it's like it has been changed, so kindly share the link as well. Thank you. Obina. Thank you. So I intend to go into a brief history. The word artificial intelligence was first mentioned by John McCarthy in 1956. He and some other team of researchers, like through the period from 1950 to 1960, they've been working to develop algorithms and other forms of applications that could help to ease some kind of services that nurses or the entire global health is working on. And then around 1970, it went low, it went down, and they call it the AI winter period, where there was a serious drop on the progress made so far. And nothing was heard about artificial intelligence again till around 1980. That is when they came up with that very applications and the software as well. So presently, AI has emerged as one of our foremost domains of research, technology, and industry. You see people using AI at different points in time. You see ChatGPT, you see people going into different forms of AIs to get information, to get to converse, to communicate, to update their knowledge on other things like that. So presently, we are in the period where AI is it. Whatever you want to do now, you have to consult in one way or the other with artificial intelligence. So please, Obina, please. So before I go into the detail of our presentation, please, I just want you to go to comment box. Just go to the comment section. Just write anything. In one word, just try to describe how you feel about AI enhancing healthcare services. Just picture yourself going into a health facility and then you know for sure that they are solely depending on AI for your care. What is that thing in one word? How do you feel about it? So we'll take just few seconds, let's say 30 seconds, just type in something in the comment section and let me see your response, please. In one word, describe how you feel about AI-enhanced healthcare services. Please just go to the comment box and okay, I can see revolutionary. Revolutionary. Who else? What do you think about AI in health sector? Hello, are you getting me from there, from your end? Okay, fine. So what is AI? AI. This is a technique and an algorithm that enables computers to perform tasks that typically are intentionally highlighted require human intelligence and comprehension. It requires human comprehension. It requires human intelligence. So we are not depending solely on the result of AI, but our intelligence too is actually required to interpret such information. So a technology that employs such kind of techniques that perform tasks and require our human intelligence and comprehension is what we term as AI. So these tasks can encompass decision-making, our learning, our pattern recognition, and then solving intricate problems. That is what AI comes to do in nursing practice. Now, let's look at the challenges. Currently, I said I was going to draw inferences from the health sector here in Nigeria, which I'm much familiar with. So let's just briefly go through the challenges first. One, I classified one of the challenges in group of clinically related, which has to do with comorbidities. A patient can come with so many other comorbidities. Polypharmacy, you will see a patient on admission with so many other medications, so many prescriptions to manage a single condition. And then antibiotic resistance, which is what we've been fighting for over and over every day now. It's just a recurrent evil in quote, so to say. So antibiotic resistance, the hospital facility acquired infections are there. Mental health and substance abuse, these are clinically related challenges that we are having on daily basis. Then workforce related. We will have seen or nurses working on the bedside. There's too much paperwork. I will always remember when we were in school, the facility where we were trained actually is somehow separated in such a way that the words are out there and then the administrative blocks are somewhere in a further distance. So when you write your report as a nurse, you run down and meet the head nurse to submit your report. If there's any problems, you have to run back and then go upstairs, write whatever you need to write, and then come back. This is too much of paperwork. If there is any medication that was served to a client, paperwork. Vital signs, paperwork. Anything that you have done to a patient, any procedure you're taking, you go back to the paper to enter. Then high turnover rates, aging workforce. We know that presently in Nigeria, if you go into our clinical settings, our clinical area, the environment entirely is aging workforce. Hello. And this can actually be linked to Japa syndrome. This Hello, I can hear sound at the background. Obina, can you hear me? Gloria.
Yes, we can hear you. You can go ahead, sir.
All right, okay. So the aging workforce is there. So most of the younger nurses are already they've already gone abroad, most of them. So Japa syndrome too is there. So we are left with much more older nurses that have been in practice for years. And most of them are staying back, likely because they feel they've spent so much years in the maybe public sector and they cannot move again for other reasons, maybe family or other things. Then technological challenges or systemic challenges. Yes, we have the facilities, but the technologies are not there. The system itself is not really being structured in a way that will somehow comfortable for the nurses to administer their own services to their patients or clients. Then educational or professional development related challenges. Of course, we know how the nature of nursing education is in Nigeria. And now, well, the National Military Council of Nigeria is working on how to strategize them and then classify nurses basically into two, HND and then degree. And we're the trends. We know that there are technological advancements. The use of electronic health records are there. Telehealth is what is trendy. The AI itself is there. And then there's emphasis on preventive or home care. By the video we watch, you can see that people are actually moving towards preventive medicine now, which is better and cheaper. And then home care services. Home care services. So people actually want to be given care while at home in the comfort of their homes. Then there's growing demand for advanced practice nurses. I have seen so many advertisements where you will have a nurse, advertisement stating the nurse must have a degree, the nurse must have this particular specialty or not be specialized on this and that. These are growing demands for advanced nursing practice or practice nurse. These ones that are having degree and they are highly specialized, maybe with a master's degree in nursing. These are some of the trends now. Acknowledgement. Acknowledging the importance of nurse well-being and safety is another thing. The nursing education and professional development is a trendy thing. That's why we have the MCPDPs, we have the WCAEA, and the many other trainings. And I will just pause here to advise that at this point, with this thing that the academy is doing, I think it's plausible if they can actually reach out to the Nurse and Midwifery Council of Nigeria. I believe a credit unit can be awarded to this wonderful initiative. So it will ease the stress of you leaving your job and then going back to attend maybe MCPDP or other things. Maybe after this training, one can have maybe 2 credit units or 1 credit unit at the end of the training. It's just by the way. Next slide, please. Are we now? Okay, we'll have a poll and it will be shared from that end. Kindly respond to it. And we just have few seconds to respond to this poll. So the question will be displayed to you. Please select, just frankly select anything that comes to mind, and then we move. Let me see your response. Let's see how you respond to that poll. Can we have the poll, please? Thank you. How familiar are you with the concept of AI in nursing care? Just pick an option and then we move. How familiar are you with the concept of AI in nursing care? How familiar are you with the concept of okay, the result is there. Pause and pause.
Yeah, we have
Good.
it.
Good. Thank you. So from the poll, please, can you see it from your end?
Yes, we can see it.
So, from what you have placed, who can interpret the polls to me? What is the major response we have in them? The major response from our poll.
Okay, I think the major one is very familiar. Has 57% of participants are very familiar with AI.
Okay.
I think that's the most significant. Should I go through all?
Thank you very much. No, let's not go to significant poll. Okay, we are very familiar. So I believe this will actually make this work easier for me and will save our time on all the projects we have ahead. So let's go to the body of the work. Okay. Okay, now. Okay, thank you very much. So AI in nursing, since we are very familiar with it, I will not take much of our time. It has the potential to enhance treatment, diagnosis, and care processes through the use of data-driven solution and specialized algorithm. These algorithms are actually being imputed for a particular reasons. They have these particular functions which we are going to discuss based on their algorithm, please. So we are going to see the different types of AIs that can be used in nursing care in the coming slides, please. Thank you. So I try to classify these AI tools into three major groups. We have the monitoring and prediction tools, decision support tools, interaction and communication technology tools. So we are taking these tools one after the other, and I'm going to select just few to discuss with us. You can actually read, it's a wide topic to discuss on, but you can actually go at your personal time, and then have this updates. So let's go with monitoring and prediction tools. Monitoring and prediction. We have about 7 that I've cited here. So I will just quickly rush through them. I'll rush through them, which is using residential sensor data for health. We'll have some pictures just to appreciate them. It's just a device that is connected to tap in real-time health data and then alert the healthcare practitioners. We discussed about home care. For nurses that are into home care, you can actually get this AI and then you monitor your client from home. Whatever happens, you'll be alerted by this same device. So we call it the automated alert system using residential sensor data for health assessment. Then we have machine learning models. This uses algorithms and computational techniques. So in machine learning models, it actually predicts the possible complications that can come out of any condition. And maybe if someone is having diabetes, it can predict if there is a likelihood of one developing decubitus ulcer, or when one is bedridden, maybe a bedridden patient or client that we have on admission, if there are signs or possibility of developing pressure sore, these machine learning models will actually pick them and then communicate the nurse that is taking care of that patient and giving a specific time frame, meaning if it's up to a week from now, the nurse will be alerted to start making a preparation or start managing or giving care to that pressure area. Then 3, predictive algorithm to identify nursing diagnosis. These ones only predict potential scenarios based on the collected information. They can predict and then help in decision making. So if you see machine learning, it only tells you what you should expect. But predictive algorithm will actually go to an extent to decide give options on which decisions or which care to give at the point in time, looking at the challenges they are having on ground. The next one, which is the fourth among this very list, monitoring and support tools, is the surveillance system. The surveillance system. Surveillance system is almost same thing with the home care tool. So this one is basically designed to interpret, collect, analyze, and interpret data continuously. So if there's any potential threats or trends that require help, so it's just like you are discharging a patient and then you are attaching this tool around the wrist or waist or anywhere or the neck of that very client while he moves around with them. So you monitor the patient all through. I attended a seminar, a webinar just an hour ago, and they were talking about how to integrate this AI into the NHS.
Hi, Mr. Toro. We lost you for a bit.
Okay. Am I back?
Yes.
Can you hear me? Okay. So I'm at fall risk prevention. This is also a tool that we use to identify patients that are at higher risk of falling. For example, if you are managing a patient who has, let's say, is having seizures, tonic-clonic seizures at intervals. Any patient that comes with that condition, like in cases of eclampsia or a woman that is in pre-eclamptic stage, can be placed on this fall risk prevention. Someone who is having repeated seizures in epilepsy too can go with this kind of tool always. So whenever there's time or is clocking towards having a seizure, there's this tool we will discuss on it. Embrace is being tied around the wrist like a wristwatch. It gives you 10 seconds notice to prepare yourself for a seizure. 10 seconds notice to prepare oneself for a seizure. So once it starts beeping, within 10 seconds, the patient is advised to take proper position and take off everything that can actually cause harm. And if the nurse is there to give care, she immediately attends to that client before they fall. Then we have Rothman Index, the sixth one. This collects data from patients electronically. And then the algorithm helps to assess patient severity and the risk of clinical deterioration. So all these are tools that we use to see how we can monitor the patient. We classify these ones as monitoring tools. At this point, you can see that nothing was mentioned about care. Nothing was mentioned about decision making, unless for conditions where the patient is required to come to the clinic. So we monitor these patients. Most times at this very point, these tools are used in community nursing or patient on admission. I said I was going to draw inferences from where I have worked before. The distance between the ward and the nursing station is a bit far. So with these kinds of AI tools being implemented in our facilities, it aids the nurse to prepare in good time and position herself so well to give care to our clients. So let's look at the other group of tools that we have on AI that assist or support nurses in their care. Decision support tools. From the name, it aids in decisions. So one of them is the decision support system for triage management. What this does generally is to extract and categorize relevant information from unstructured clinical notes. Now, these notes can be maybe doctor's notes, maybe the diagnosis, signs and symptoms, presenting signs and symptoms, the result of the patient. They may not be structured in a way. But what this decision support system means that it's a pool of data of that very patient that will be triaged to place patients based on their conditions. And that will actually help the nurse to decide who to call for what care and at what time. So different information are being imputed into this very system and then they try to categorize them or triage them based on the presenting signs and symptoms, based on the reported signs and symptoms, based on the vital signs that were taken, and any other report that was written regarding the patient. Then the next one is the clinical decision support system. This also relies on algorithm. And in this case, it only analyzes clinical data and then the evidences that we have. If there is a pool of data in the patient's report, or yes, in the patient's profile, it offers personalized and evidence-based guidance, not based on their response to disease, not based on the medication they have been placed on. So in nursing care plan, we have individualized nursing care plan. What this clinical decision support system does is to categorize these very conditions and then treat the patient as an individual, not as a person having a particular disease condition. So no two patients having the same diagnosis will come with the same nursing care. So that is what this clinical decision support system does. It helps us really categorize them based on their response to a disease condition. Based on their response to a disease condition. And then we have nursing expert systems. Nursing expert systems works almost the same thing with what the clinical decision support system does. The difference here is the clinical decision support encompasses everything, like from this decision support system, the doctor's report is there, the lab is there, every other thing is there. In fact, the report from the community the patient is coming from is also imputed in that data. But the nursing expert system is being built and decisions are taken based on the nurse's observations and based on the nurse's report, purely. Then health information management system, I will not take much time on this. This is something we always see in most facilities. This one carries so many, it stores, manage and transmit information related to patients differently at all points. You will see the clerk will be there, the payment of the patient, maybe bills of the patient will be there, all the reports, all the data will be imputed in health information management system. This is always good. This kind of report is always good for large-scale researches over time. So health information management system is something I know most facilities are already buying into it and are putting them to use. And so these are the 4 decision support tools that we have. So, can we go to the third group of tools? These ones are interaction and communication tools. These ones are engaging. These are tools that engage the nurse while on duty. What this does generally is maybe during an interview, it tries to transcribe the patient's language and then organize it and then analyze those same words or the statements the patient has said into a more structured note. So if a patient comes to you and you don't understand Hausa, and then that automated classification system is there, and the patient is communicating with you in Hausa, so it will transcribe it and then give you some forms of idea about the nature of the complaints of that patient. While the voice recognition, being the second one I have here, recognizes it's just like a feedback to what automated classification system does. It tries to convert the healthcare practitioner's speech into written text. While watching the video, we saw a nurse taking vital signs of a child and she took it and left. And the next thing maybe is just to register it. But in this case, if a nurse would take temperature and said patient's temperature 36.7, it will be entered directly into the system without the nurse carrying paper or pressing any keyboards around her. That is the voice recognition system. It recognizes voice and enters them into the patient's data electronically without the nurse or healthcare provider typing on the keyboard or writing anything on a paper. Then electronic reminders. From the names, is just to put up a reminder. So we use nursing care organizations to assist healthcare practitioners remembering important tasks. So it's just like timer. You're just timing yourself. If there's time for it's time for medication, the timer is there. If there's any particular care you have to give to a patient, maybe you are to change position after 30 minutes, you can now activate this electronic timer to give you prompts. After 30 minutes, you go and change the position of the patient. That is just what this tool does. Then we have mobile app for emergency services. These ones have been in the market for years. You see people going with smartphone, Apple phones, Samsung. So there are so many softwares that are developed with this mobile app, and they help to check maybe reading, maybe most times fibrillations. Atrial fibrillations are being used with this very app. But recently I saw an app by Samsung that checks sleep apnea in cases of apnea, where one is having difficulty in breathing while sleeping. Samsung developed this very app, and they just made it in the form of a wristwatch too, into a smartphone, a smart wristwatch. So the patient that is having sleep apnea can always brace his wrist with that very tool and sleep. So it gives the time or duration of seconds or minutes, so seconds, that the patient has not really taken any breath while sleeping. So this mobile app for emergency services help to prompt the nurses and they always go down there to download the details and then assess the patient without saying much to the patient. So they have the devices with the patient, and as well as the patient is lying down, they are taking notes of this repeated maybe presentations of this apnea while asleep. So I just want us to go through and then see some of these very devices just to appreciate them. Please, am I too fast? Am I talking to myself?
We're with you, sir.
Okay, since it's only Gloria. So the chatbots are there. Robots are there. Now, robots are assisting nurses to move patients and then assisting even to dispense medications. I've seen one last month in one Chinese hospital. I pray EHS should get there. Looking at your structure and the facilities you have on ground, I know it's something that is achievable. Once the doctor prescribes any medication, he drops the prescription to the robot and it goes straight to the pharmacy dispensing room. And then the pharmacy also goes through the procedure, the prescription, and then drops the drugs that have been prescribed. And the same robot will take it back to the nurses, and then they check and start administering. So this is what robots do in the nursing care. They help in lifting patients, they aid in so many other things, transport patients to stretchers, and support them during mobilizations too. Then electronic reminders, I've discussed that already. It's the same thing with the one we have mentioned earlier. So please, let's see them. Let's appreciate what we use now as an AI assistant. So we have few. There are so many. So these are just the three that I was able to pick. To your left, you will see the deep reading AI. That's the Drive. It's a software that is being installed in a smartwatch. We have the irregular reading notification feature that was developed by Apple. So those people that are having Apple wristwatch, this one is there for you to use. It's part of our AI devices. Then apnea feature, I've mentioned that, developed by Samsung, is also there. Just like wristwatch, you will see all these details there. If one is having sleep apnea and you're able to install the software, the person can always check with the device. The embrace is there, this white one in the middle. You can see it's just like a normal wristwatch, but it gives prompts whenever one is about going into tonic-clonic seizure. So it starts counting and beeping. And it's always precise most times. At the count of 10, or it depends, it may be 20, it depends on the seconds it gives or minutes, seizures occur. So once these prompts are there and the healthcare provider is being prompted by or is being alerted by the beeps, you move close to the patient and make sure that the patient is safe, that make the patient lie down while you wait for the seizure. Then we have spectral MD deep view wound imaging. This one only try to assess perfusion, circulation, this microcirculation comparing normal skin and injured skin. So it tells how perfused the skin is. In cases where you are managing a patient with the cubitus ulcer, this spectrum will actually tell you how well perfused that very area is. If it's not well perfused, you know you are heading towards necrosis. So this is what spectral MDD and prepares your mind as to what kind of care you give. At the introductory part or definition of AI, we said AI is not taking over what we know. We are using our own intelligence and then our judgment and then our judgment. So these are just the few that I can pick from here. Thank you. Let's go to the next. Please, if you have any question or any challenge, let's see how we can sort that out. I'm almost done here. So will robots take over our jobs? This is another poll. We discussed about robots administering medication, robot assisting in lifting patients from the ward or taking them out, mobilizing patients, helping mobilization of patients. So in your own thought, in your own mind, do you think that these robots are here to take over our jobs? We have a question that is coming from the poll. Please, you should kindly respond to it as we move. How likely are you to adopt AI-powered tools in your nursing care in the next 6 months? Looking at what we discussed, how likely are you to adopt AI-powered tools in your nursing care in the next 6 months? Kindly respond. This should not take you up to 5 seconds. How likely? It's a poll. Please try and participate. Just tick anything that comes to mind. In the next 6 months, are you going to adopt AI-powered tools in your nursing care? Very likely, somewhat likely, not very likely. Are we taking the polls? As one poll.
So we have the results already. 50%.
Okay. Very likely and somewhat likely. Very likely and somewhat likely. Very likely 50% and somewhat likely 43%. So that is good. It means we've actually accepted this to be part of us. So I'm happy to meet nurses from that end, where I find myself, some are finding it difficult operating the computers and they have phobia for that. But this is good. This is quite encouraging too. Let's continue. Okay, so you may have this fear. What about ethics? How about ethics? How do we go about ethics? What if there is a challenge along the line? What can we do? So I have a few of those things. The challenges are quite much and the ethical issues are much. As of this afternoon, while attending that training, I have listened to so many of their complaints, and it's basically on ethical issues, ethical challenges. So let's see the first ethics challenge that we're having. The ethical consideration is privacy and data security. The robots will not really care if one is a nurse or not. Once you have your hand on that device, you get all the information you need about a patient. Once the device is in your hand and you can access it, you have all the details. So it's already a problem in nursing. An issue of privacy and data security is actually a big thing. And we always give them this very feeling that they have this trust in us, and the issue of confidentiality too is there. So privacy and data security has always been a challenge when it comes to AI in nursing. And then methodological considerations. There are ethical concerns about AI existing because technology may not only impact an individual patient's end result. There are these challenges. The methodology used in development, since we have few nurses, maybe in AI, I've never seen algorithm that is developed to bring about this very advancement, may not really go in line with what the nurses are doing. Highest is just to inform them on maybe what the interface will be like, and then they develop it based on their perception of what the nurses are trying to put across. So the methodology used can have problems of designs, testing, and it can be a challenge too. So the performance of AI in this regard is only as good as the data used to develop and design it. That's the highest it can go. So the best we can do, our responsibilities as nurses, is to ensure that appropriate use and outcome are traceable to ensure ongoing evaluation. So as you are
Hi, Mr. Toro, we lost you. Hello? Hello? Hello, Mr. Toro? Hello? Gloria, can you hear me? I think you dropped. Hello, Mr. Toro?
okay. Sorry for that glitch. Obina, are you there, please?
Yeah, you're welcome back. Yes, please go ahead.
Okay. Sorry, thank you for that. So we are talking about
Hello, Mr. Toro, can you hear us?
Yes, can you hear me?
Yes, we can
Hello?
hear you now. Go ahead, sir.
Okay, I think he's having network issues. Let me reach out to him.
I can hear you from here, Gloria. Can you hear me?
Mr. Toro?
Yes. Gloria?
Just go ahead. Go ahead with the presentation, sir. I think her network is delayed.
All right, okay. So this justice encompasses respect for diversity, inclusion, and equity. These keywords, diversity, inclusion, and equity, is what we are looking at. So how can an AI really treat people based on their maybe social background, economic background, or based on their regional background too? This is another issue that has actually been raised concerning the use of AI in nursing care. So justice and fairness ability. So this is where the challenge is when it comes to ethical consideration that we, as regards AI. Then professional ethics. Professional ethics. They said nurses are compassionate. They attend to you with all compassion. But an AI doesn't know if you are a chief. They don't know if you are having a title at home. They don't know if you are a senator. They see you as just an object to be lifted up from the bed and then to the chair and then be moved. So those are ethical challenges that are actually haunting us in the use of AI. The interpersonal communication in healthcare. Somehow it limits that interpersonal communication in healthcare because the nurses will be seen to work at par with other health workers, which has been an issue that they've been working on. They've been working on that interpersonal communication to see how they can integrate all the health workers into one single system, whereby decisions will be made as a team and not just as an individualized profession. Then addressing bias in algorithm. I've mentioned that earlier. Most of the people developing these AIs are not really trained nurses. They are software developers, yes, and they use just a perception or an understanding raised based on the presentation met to them. So every day as you're using this AI, challenges are seen, some defects are being picked out. But what we will do as nurses is to always give feedback as they develop this. I've said it before, AI has come to stay. Ours is just to look at the loopholes and see how we can give bit feedbacks and move from there. Then excessive dependence on technology. This is another ethical consideration and a serious challenge. People depend so much on technology now that they feel whatever comes online, whatever comes from the internet is correct. Is correct. Students in the school, when you give them research or assignments, they go to ChatGPT, and before you know it, you have a complete result, a complete presentation or research within days. So there is excessive dependence on technology. So ensuring trust in us. Please, are you hearing me, please?
Yes, we can hear you.
So we said that AI requires human intelligence and comprehension. There is no way you can interpret an AI result without comprehension. So we cannot in any way depend solely on AI and then neglecting our intelligence and our comprehension as it is. So these are some of the ethical challenges. These are some of the ethical consideration and the challenges we are having. And I know that possibly within your mind, you'll be thinking, okay, so now that we are having these challenges, what is the next thing to do? So I just want you to go to the comment section. Just mention one thing, just one benefit of AI. We're not thinking, just mention one benefit and then we move. If you have time, just go to the comment section now. Write one benefit that you think AI has added to nursing care. Just one. You can answer that in the comment section, please. So while we are at that, okay. Simplify the nursing care. Thank you. Agatha said accuracy. Accuracy. Thank you for that word. Improve documentation. Samuel Elijah, thank you. Okay. That's helped to improve patient care, reduce workloads. Okay. Easy access to health information. Thank you, Opatamesi. Thank you so much. So all these that we're saying from simplifying nursing care, yes, it does. You know, you just sit and then you have your prompts. You know what to do and you do it at the right time. That is accuracy. You do the right thing at the right time. So it helps to simplify the nursing care. You don't have to go about carrying books, papers, and other things. This excessive paperwork will be cut short. And then you go straight to the point, administer your care and move. Improve documentation. Yes. For those that are having voice recognition, as you are just saying it, okay, BP is 120/80. It has entered. You move. You don't have time to, you are trying to what you document as you administer. So after administering any care, you document. So that's actually gone a long way to help to improve patient care. So thank you very much for your response. Let's see just a few of those things that the future holds for us in nursing. Just few. There are so much to achieve. What is there for us as nurses, the future of nursing using human and AI collaboration? What do we have ahead of us? What are we looking at in the next few years to come? One of them is to development and then future advancements in technologies related to AI. I've mentioned it earlier that most nurses are not into that. So we will need more nurses to go into maybe robotic nursing or AI nursing if there's anything like that, so that they can actually build their proficiency and skills in AI to go a long way to help us to use a language that is ours, by us, and for us. So development and future advancement in technologies are there. So with the feedback we are giving, they are developing more AIs for us to actually work with. Then greater impact on improving healthcare. Greater impact, yes. We talked about the challenges we are having about maybe polypharmacy is there. Comorbidities, but where you have AIs that can actually detect and support you in decision making, you go into computers for all these gadgets now. All these gadgets we have, engineers can actually, nurses can go into such fields to explore other opportunities outside the core nursing care. Reduction of workload. We've mentioned that workload is drastically reduced with the introduction of AI. So you conserve more energy working with AI than going about with your paperwork or the traditional nursing care services. Use of virtual patient for nursing student training. With time, the nursing student in Nigeria will not be using Miss Jones or Master Jones for practicals. They will have virtual patients that can respond to any stimulus, any touch, or any sound. So the student on training will know if he or she is doing the right thing or not. It's not really subjective at this point, but it's subjective. The results are there. The student will know if I have actually administered this care appropriately because it's virtual patient you are working with. So the close to real response will be seen and be felt by the nursing student during training. So no more Mr. Jones, no more Mrs. Jones. You don't have to pick them anyhow. If you pick a patient anyhow using this virtual patient, they respond. And their response are always as it is in real life. Then AI bots are improving data retrieval and patient care delivery. Yes. Now, if you want to just get data from patients, we've discussed so many of them, so many tools that we use that you can just, at the tap, you get all the detail you are having. You can decide where the location of that patient is. Issue of follow-up will be made so easy for us because we know where the patients are. They are carrying our devices with them, and we know the responses they are having regarding a particular disease condition. So it helps in improving data retrieval and patient care delivery. So all in all, these are some of the future events that we should be expecting in nursing. I'm not sure these are meant to get us scared, but I'm sure it's a way to go. Identified our challenges already, and we truly believe that it's definitely going to be as it were in other countries. So nursing is at the cusp of revolution and is driven by AI and technology. Just like any other profession is being driven by this AI and technology revolution. So there's this need for us to harness our power, the power of AI, and then enhance our nursing practice and then improve our patients' care. So we as nurses cannot just throw away this opportunity that comes to us to really help and to support our clients or patients during our normal nursing care. And the time where we move about going about from one unit to another, requesting for this, requesting for that, is far gone. At the comfort of your home, you can be monitoring your patient. At the comfort of your nursing station, you can actually know what is happening with or what is wrong with your patient on admission or at home. So we have to embrace this very opportunity and then harness this power that we have from AI to improve or enhance our practice and then our patient's care as well. Well, thank you very much for your time, and sorry for the glitches that we experienced so far. So I would like to get responses from you. I want to get comments, and thank you very much.
Thank you very much, Mr. Toro, for this wonderful presentation. I am very, very sure that our participants are as excited as I am. To our participants, if you have any question that you want to ask now, kindly indicate, or you can type your questions in the Q&A box, and then we'll try and respond to it as much as we can. So this is a time for comments, questions. Okay, Cintiq Success is saying thank you so much for this wonderful presentation. Agatha, thanks for your time and input. Thank you, Agatha. Okay, so it's appreciation so far. I thought a lot of people will have plenty questions to ask. So. Okay, Sanusi Ghana, thank you for this timely presentation. So it's all appreciation for you, Mr. Turu.
Thank you for the time. Is it the Ramadan fast or the Lent?
Yes. Okay, we're still awaiting questions from our participants. Obe Cordelia, thanks for the presentation. Opata Mercy, thank you for this insightful presentation. Okay, I think it's Thanksgiving all the way. We're expecting questions, please. Comments. Okay.
Okay, can I send one from my participants?
Of course, you can, sir.
Okay. Please, any of us can just unmute the mic and just identify anyone that you are using in your facility right now. Any AI appliance, software that you are familiar with, that you're presently or currently using in your facility. Anybody can just mention that. Let's learn from that angle too. Briefly. Thank you.
Okay, Mr. Obina, can our participants unmute their mic? Mr. Obina, I think he was having control of that before. Okay.
Yes, they
Mr.
can.
Obina?
Is there anyone you would like to?
It's okay. All right, so to our participants, Mr. Torre is asking if you have any AI tool that you're currently using in your facility, you should kindly share it with us.
So anyone that would like to speak can just raise their hand so we can give them the permission to do so.
Okay, so before, all right, let me take this question from Sanusi Ghana. He says, "Sir, my question is, how do you relate nursing informatics in relation to AI? How do you relate nursing informatics in relation to AI?"
Okay, thank you for uh, that question, Mr. Ghana. Can you hear me? Hello?
You can go ahead, sir.
Okay. Okay. How do you relate nursing informatics? Is that the question?
Yes, how do you relate nursing informatics as in relation to AI?
Okay.
Like, are they the same or are there
Yeah, yeah,
differences?
I get they are nursing informatics is a field that combines the nursing science itself, computer science, information science, and so it's just like you having this touch of the AI in the nursing itself. It's just artificial intelligence that can be used. But nursing informatics is a field in nursing itself that uses that very computer science knowledge and information science knowledge to manage and then process nursing data. So for those that are in nursing informatics, they have chosen that as a field of practice, while other nurses can use that same AI to practice nursing care itself. So they are interwoven, but AI on its own is a device. Nursing informatics is a field in nursing. I hope I'm making this much clear. So the AI is something that supports you giving the nursing care, while the nursing informatics is a chosen field by any nurse to go in using nursing science, attaching computer science and information science to maybe develop an AI or develop a particular software or applications that can be used in nursing care. So nursing informatics, I always advise or encourage people to go into that because it's a trendy field now, looking at how much we are somehow using the AI itself. Nursing informatics will go a long way to help us create, I have mentioned, is creating our own software for us and by us to be used. So nursing informatics is just a field, just like a specialty in nursing, while the AI is just the devices or the softwares we use in giving care. So anybody can use that device, but not every nurse can be a nurse in informatics. So I hope I made that clear.
Okay, Mr. Ghana, hope that is clear. So we can say if you are studying nursing informatics, you also study AI. AI is
Yes,
under nursing informatics.
part of the curriculum.
Okay, yes. So I think we have another question. All right. Are there approved courses or training in nursing related to this AI? That's another question.
It's gonna be. Are there approved courses?
Are there approved courses or training in nursing related to this AI? I think that's what you just answered, the nursing informatics, right?
Yeah. Um, nursing informatics is there. I have seen somewhere, I said I was going to be drawing my inferences in Nigeria, where I'm so familiar with. For those of them working abroad, maybe they'll give us more light on that. But I've seen robotic nursing somewhere, and I don't know how far. I've not really followed up on that. While checking on nursing informatics, I saw that last year. I have so much interest in nursing informatics. I've made my research is concerning that, and I got my hand on robotic nursing. But I don't know if there's any course like that. Then maybe you give us, if there's anybody that can actually assist us from there. Let's know if there's anything like that around them. But here in Nigeria, no.
Okay, thank you, sir. So another question is, what if during administering medication, for example, injection to a patient by one of these AI robots, and the power goes off? What will be the fate? This is so funny.
Being a Nigerian,
What will be the fate of that patient at the moment? And how
a
would the robot
Nigerian.
and how would the robot reboot or recharge immediately without delay? So the Nigerian factor
Okay,
will happen to the
yeah.
robot.
Actually, the robots are powered in such a way that maybe they have batteries. And of course, if you are going into robotic or telenursing or telemedicine, of course, you should have this steady source of power supply. If nothing, you should have at least an inverter or another source of power supply, not our the regular one we're having here. So of course, these issues come. I thought the person is going to ask me, what if the robot breaks down halfway? There are some glitches that can just come now, and something will happen. What if that happens? So that is why we said these AI are not really taking over our intelligence and our comprehension. They are robot quite well, but they are being controlled by humans. Now, the algorithm has given them that precision, but the command comes from a nurse. The command will definitely come from a nurse. A robot cannot just pick up itself and go to start serving medication. So one of the duties of a nurse while reporting on duty is to check that all these things are working, are functioning, or are functioning very well. So in case where you are not in Nigeria, and then in cases where you are not a Nigerian or you are not in Nigeria, and you are having such challenges, I'm sure we have software engineers around. We have electrical engineers, electrical electronics engineers that will take care of that. But where that happens, of course, it's another challenge that the management of the facility will have to come in, and then you as a nurse will have to give evidence that you have actually checked this device and it was working when you started work, or you've checked it and you experience a particular glitch and you report to the people involved, then you can be set free. But where this case happened, nobody will say, it's the robot that made a mistake, but you that is operating it would be the one to answer the query. So please, first things we do is to check. Thank you.
Certainly, sir. We know that once you are on duty, you are responsible for everything that happens during your shift. So you're accountable for whatever happens during your shift. So including monitoring the robot as well. But thank you very much, sir. Another question says, how can the DEI with AI be resolved? DEI, I don't know what that means. Did you mention anything like DEI in your presentation? Hello, Mr. Toro.
I said, is it the
Hello?
DRAI or the DEI? Hello, can you hear me?
Yes, I can hear you now.
Is it the deep reading AI that they drive or what? What is the question? DEI or
Okay, I
what is
just
it?
saw DEI. So, Agatha, please kindly clarify your question. It's not clear. Okay, I think aside that, we don't have any more.
Hello, Agatha.
Okay, she says diversity, equity, and inclusion. That's the DEI she's talking about. Diversity, equity, and
Ethical, but how can it be? Please come with the question.
how can the diversity, equity, and inclusion be resolved with AI?
Oh,
I'm
it's
not
a
really
good
asking your
question.
question. Oh, okay.
Yes. I get the question. It's
It's all right.
actually an issue. ethical challenges that we are having and considerations as well. It boils down to the algorithms used. And while presenting, I mentioned that the nurses have to go into this, really impute what they want to be given to them as an output by the robot. So what is the robot works like a garbage in and a garbage out stuff. So there's an input which will be processed, and then an output which is the result that you see with the robot. So diversity, inclusion, and equity is something that really needs a human to really impute. And I will always go back to say that these robots are just like, let me use the word boy, sorry. They are just what yes, zombie. Whatever you say, they do. Whichever command you give, they administer. So equity, diversity, and inclusion may actually be an outstanding problem that we may actually work on for a very long time, because it needs human presence. It needs compassion. And then when we have nurses that are in there, I'm not so good with the computer software. I'm not a software engineer, but I believe with our suggestions, there could be a way. But I will not be a prophet of doom to say that it may be very hard for a computer to initiate this, to consider diverse nature that we have, the equity, and then the inclusion too. Of course, we may work on inclusion when it starts asking you questions. Issue that have to do with voice recognition, and then can go a long way from the questions to classify the people based on the data they have received from them and give them the based on what they have gathered, the data received. But diversity, it needs the nurses for now. So that is why there is no fear that these robots are taking over our jobs, isn't it? Because definitely where there are robots, there must be a nurse close by. So diversity and inclusion still require the nurse to be present to administer such kind of care with the patient that comes with a different from a different background, with different requests or demands too. So for now, I would just say the nurses have to go in and work alongside the robot too, while the software engineers are looking into it to see how they can marry that into their programs. Thank you. I don't know if there's any addition. I have seen software engineers in your organizations. I have seen some of their profiles. If there's any of them in this meeting, they can actually chip in something from their professional points to go a long way. Thank you.
Yeah. Thank you very much, sir. Um, I don't think we have any more questions. Okay, so we'll give some few seconds. If you have any comments, any questions that you want to ask, the floor is yours, please. To our participants, you can actually speak to us. Okay, none for now. So I think our time is fast spent. I want to use this opportunity on behalf of EHA Clinics and EHA Clinics Academy to thank you, Mr. Toro Ishaku, for giving us your time. You spent so much time and resources on this webinar. I want to appreciate you for your efforts. And to our participants, thank you all for joining us today for this insightful session. We've had the privilege of exploring how artificial intelligence is not only transforming the way we approach healthcare, but also revolutionizing the nursing profession, enabling us to deliver more efficient, precise, and personalized care to our patients. So we hope today's discussion has sparked new ideas and perspectives on how we can embrace AI to enhance our work. One of those days that we see AI as a threat to our jobs. and also improve patient outcomes. Then remember, the journey toward a more technology-driven healthcare system is a collaborative effort. And as nurses, we are at the forefront of that transformation, actually. So thank you again to our esteemed speaker, our participants, and everyone who contributed to today's event. We look forward to seeing how the knowledge shared here today will inspire innovation in the nursing field. Thank you so much for joining. Mr. Obina, anything from your end? Okay, Mr. Toure, is like you wanted to say something.
Nothing much. Thank you so much. Thank you for the privilege. I've learned a lot from my participants too. And I wish you all the best in your organization, hoping that you consider this as an avenue to have credit units for your nurses in that organization. You can liaise with the council and get some units to help you too. Thank you so much.
Certainly, and thank you so much for this suggestion. It's a very good suggestion, and we'll look into it. So have a great day, everyone, and let's continue to move forward together in shaping the future of nursing. Thank you so much, and have a wonderful weekend ahead. Bye.